Good afternoon, everybody, and welcome to the Prevention and Management Board's meeting on questions and public meeting with questions as well. It's great to know you're all out there, and thanks very much for all the wonderful work you're doing, everybody out there. I'm Jackie Drayton. I'm the Cabinet Member for Children, Young People and Families, and I have public health as part of my portfolio responsibilities as well. And I'm the councillor for Burngreave Ward, which is where I live. Unfortunately, the chair of the meeting, Councillor Bob Johnson, has been called away to an urgent meeting that he has to go to, and he can't be here today. So I'll be the chairing this meeting. I'd like, first of all, to ask the people on the panel to introduce themselves, and I'll go through and just ask them as I see them. Councillor Mohammed.
Thank you, Chair. My name's Shafak Mohammed. I'm a Liberal Democrat councillor for the Ecclesall Ward in Sheffield, and I'm also the leader of the opposition on Sheffield Council.
Thank you, Shafak. Councillor Johnson.
Morning, afternoon. I'm Douglas Johnson, councillor for City Ward and the Green Party member on this panel.
Thank you very much, Douglas. And Simon.
Yes, hello, I'm Superintendent Simon Verrill from South Yorkshire Police. I'm the Sheffield Neighbourhoods and Partnerships Manager.
Thank you very much, Simon. We also have Dan here.
Dan Spicer, I'm Strategy and Partnerships Manager at the Council.
Thank you, Dan. And today we're very fortunate. We've got two members of staff from the public health team. First of all, Magda.
I'm Magdalena Boo. I'm Health Improvement Principal within Sheffield City Council Public Health.
Thank you very much, Magda. And Susan, last but not least.
Hi everyone, I'm Susan Hurd. I'm a consultant in public health in the council and one of Greg Fell's deputies, so I'm covering for him because he can't be here today, unfortunately.
Thank you very much, thank you. And I'd like to welcome all the people that, if there are any in the gallery, we've got some very, very interesting questions, thanks to everybody who've put them in. And maybe we'll have some more from people in the gallery after we've had our presentation. The agenda is very simple. Firstly, we have a presentation on the situation report on where we are on the pandemic at the moment. Normally it's Greg Fell. Unfortunately, he's unable to be with us today, but we've got his deputy Susan who will present the report. And then we'll have questions from the committee, and then we'll go to the questions that have been submitted to the meeting before, and then we'll ask any other questions. Okay, thank you very much. So over to Susan. Thank you very much, Susan. Would you like to start?
Thanks, Jackie. And I will just bring up my screen so I can share it.
It's lovely. Thank you.
Everyone, let me know if you see this.
Yes.
Grand. I'll get that up as the hopefully this will come up in a minute as the actual presentation. There we go.
Lovely. Thank you very much, Susan.
That's all right. So yes, I'm here to give you an update on where we're at as of today. Briefly to begin with, just a little bit on what mobility trends look like. So this is in terms of percentage or numbers of people who are walking, driving and using public transport. And I think this is quite an interesting chart because it shows us the levels of these routes of mobility since January last year. So we can see what happens in April with big drops and then slowly rising back up again. And we can see obviously it's dropped quite a bit since October, November, December. But you'll note that it hasn't gone as low as the first lockdown in April. And a big reason for that is actually that the restrictions this time aren't as restrictive as they were the first time round. But it is useful to see that people are moving around less in this obviously current restriction than they were previously, but obviously the disease is still circulating. So in terms of the epidemic curve, I'm sure all of you will have seen this chart now many times. You can see that the number of cases, we had a big peak going back to September, October time, people remember, and then a steady drop with various restrictions coming in. But then once you get to December, you can see that the rates rose again, and actually particularly around Christmas period, as we expected would happen because of some of the mixing that was allowed. We since then had quite a takeoff in rates around about the Christmas time, or just after Christmas period. Obviously then national lockdown came back in again, and you can see that the rates have been falling, which is fantastic and really good. I would draw, I think there's some particular things about this chart that are particularly interesting. So the pale pink bars are the tests that are done on people in hospital, more or less. And the darker pink is the tests, people who are testing positive in the community. And I think when you look back to March, obviously we weren't testing in the community around that time, so we do just have the light pink bars. But you can see that the size of the curve then is not dissimilar to where we are and have been since October, November, December. And so that means, and I'll come on to it later on, but although our infections are dropping, which is fantastic, hospital is very, very busy. There are a lot of people who are in hospital with COVID, and you can see that, I think, reflected in the pink bars. And so that has implications for what might happen next in terms of when and when we come out of lockdown and so on. So a little bit about the new variant that's been circulating that's more transmissible. So it's the B117 variant. So this is the one that was first, that Public Health England first brought to everybody's attention back in December, and that was circulating in the south of England. The chart shows how this has been spreading across England, and actually this chart's a little bit out of date now. Dark purple means there's an awful lot of that variant around, and in fact in the south of England and then up in Cumbria, you can see it's probably close to 100%, and certainly 90% and above. For ourselves in Yorkshire and in Sheffield, we didn't have as much of this variant back in December, though it was there in small amounts, but it is spreading. So we now have more of this variant in Sheffield than we did last week and the week before. And estimates, it's difficult, but estimates maybe say maybe up to about 70% of COVID circulating now is this new variant, this new, more transmissible variant. And that's important because it does have an impact on numbers of infections and what we might expect to see happening over the next few weeks in terms of infection rates dropping. Infection rates, we think, will continue to drop, but not as fast as if perhaps it was the older variant, because this new one is more transmissible. However, it's really important to say that things are still quite different across England, and we are lucky in Sheffield in that our infection rates haven't gone nearly as high as they have in the south of England and up in Cumbria. And the bottom right-hand chart on this picture is us in Yorkshire and Humber. And if you compare that to ones in the top row, east of England and London and so on, you can see that our infection rates are much lower. So that's fantastic news. But like I said before, our hospital is still extremely busy. Infection rates are still too high for comfort. But again, it sort of gives us an indication perhaps of what might be to come our way when lockdown might stop and things might shift a little bit. So the 7-day infection rates since December, again, there's good news in these charts. It's always nice to be giving some good news, cautious good news. So the over 60s on the left and the whole population on the right. And you can see the blue line, so the number of infections in over 60s rose up over the Christmas period and is now tailing off, and ditto for the whole population. So again, good news, but rates still too high. And you can see all those red bars along the bottom, which is showing that the infection rates are still higher than we would like them to be, but at least it's going in the right direction, which is great. So positivity, this is about the people who get a COVID test, what percentage of them test positive? So again, you can see going back to middle of December, about 6% of people who went for a COVID test actually had COVID. That's risen quite a lot. Again, not surprising given the way the infection rates took off. Has gone as high as about 14% and is now dropping a little. But you can see this chart isn't as positive, if you like, as the charts I just showed you, because it's not dropping fast, and we want to see that dropping further. That's really important when we think about when and if we might come out of lockdown and what the next steps might look like. This chart is about the number of infections by different age groups, and I'm sure Greg's shown this quite a few times as well, and it's consistently telling us the same story, which is helpful, which is that our under 18s, and particularly our younger children, have the lowest levels of infection, and that's been pretty consistent. And actually at the moment, it's mainly our working age adults who have the highest rates of infection. So that's where we need to look and focus to try and get the infection rates down. And of course, some of that's because working age adults, many are essential or key workers and cannot work from home. So they're out and about and therefore more at risk of picking up infection, but also more at risk of passing it on to somebody else. This is the sad chart. This is one I find really difficult, actually. So, and it's really important people understand it is still a very dangerous and very easy to spread respiratory virus, because this is the chart that shows us deaths in Sheffield. And you can see the peak in deaths back in April, May time from the first wave. And then you can see the peak in deaths now appearing again from November, and it dropped a bit, but it hasn't dropped as low as it did when we look at June, July, August. It was very low. We were seeing very few deaths. We think, we know that although infection rates are dropping, hospitalizations are going to continue for a period of time. So the hospital is going to stay busy, and the numbers of deaths will stay, sadly, quite high for quite a period longer than that. And so that's why it's really important for everybody to continue to stick with the programme, really. And thank you, everybody who I know so many of you are doing that, and we really need you to keep going. So thank you very much. So sadly, I think this chart will continue to have quite a high number of deaths for a period of time, although our infection levels are dropping. So a quick summary of all that epidemiology, the R0, which is whether the pandemic is growing or contracting. So it's still above 1, we think, at the moment. So that's not great. We need that to come below 1, but it has been dropping. We're down to now fewer than 250 cases per 100,000, which is great. So that's good news. Positivity is still around 11%. That's too high, but is slowly starting to drop. And I've said it a few times, the hospital is busy. So STH is Sheffield Teaching Hospitals. They are very busy. They have a lot of people in there with COVID, and more are coming in every day. And that's the critical thing for us at the moment. We cannot afford to take our foot off the pedal around everything we're doing to reduce infections, because the hospital is so busy. The impact of the new variant does matter because it's more transmissible, so more people can be infected. So we just need to take that into account. Greg did say to me when he sent me this slide, he's been having a bit of a gloomy week. So he said 0 room for manoeuvre, and he's right, there is 0 room for manoeuvre, but I do think it's important to say, like he said there, this isn't London, it isn't the southeast. Rates are nowhere near as high, but they are still far too high, so we can't afford to take our eye off the ball, basically. What do we do about it all? Well, the outbreak control plan is still largely the same things we need to do. Nothing is changing, even with the new variant. So we have, as you'll see, this big list of things that we're doing with partners, with other people across the city. And the Swiss cheese picture is a brilliant picture because it just reinforces that no one thing can stop the spread of infection. Actually, it needs to be a whole bunch of different things. And with the new variant, that doesn't change. It just means we need to be even more stringent about all the different bits in the Swiss cheese model, if you like. The same things will bring the new variant under control. We just need to be stricter about them and keep our eye on it. And obviously asymptomatic testing is coming in Sheffield, and the vaccine is obviously being rolled out, that's fantastic news. So the plan, there's a question here, I think, for ourselves in Sheffield, but also for the government around a zero COVID approach or endemic disease. Endemic disease means accepting lower levels of disease just continually circulating. And both strategies have pros and cons and advantages and disadvantages. So we can control some of these things ourselves, but some things are obviously within the government's gift. But there are developments that will obviously continue to come, rapid testing, and results for people with symptoms and without. more rapid and more complete contact tracing, and better support for people to isolate. And there's obviously been quite a lot of media chatter about that today and yesterday. And high coverage vaccination is obviously something that is very important. So I think this just takes me on to my last slide, which is a bit of an attempt at a crystal ball moment, which is always tricky. But basically, lockdown is having the impact that's expected, but because it's not as strict a lockdown as March, and because we've got the new variant circulating, we aren't expecting infection rates to drop as quickly as they did back in April, May. But on the plus side, we've got vaccination now, and we didn't have that then. So that's the brilliant news. And huge progress is being made with that. We've had tens of thousands of people vaccinated already in Sheffield. However, it's really important to stress it doesn't take away the need for the basic public health measures. And that really is important to stress. I've been hearing today from some of my colleagues about it. Vaccination jubilation is the phrase that's being used. So people who think once they're vaccinated that they don't have to be cautious anymore. And we need to stress to folks that it's brilliant if you're getting vaccinated, and it will really reduce your risk of getting severe disease and dying. But it doesn't mean that you can then do all the things that you've missed over the last year, because there are still significant risks. So please, if you're vaccinated, fantastic, but continue to be cautious and take all the measures that you've been doing so far. So like I said, the new variant's about 70%. It may mean we end up with a higher baseline rate when it settles than we did. So last summer, we were actually down at about 15 per 1,000 infections, per 100,000 infections. We don't think we'll get anywhere near that, but we might get down to 150, 100 per 100,000 infections. So that has consequences for the hospital, because you can see how that will continue to mean more people, certainly compared to last summer. And this is for the immediate foreseeable future. I'm not talking about autumn and beyond, really, because things will be different again by then. Household transmission is still the key thing. So it's still being driven by people who are infecting each other within a household because you live together, or by people having contact with each other in those sorts of settings. The core things remain. I've mentioned them already, but we'll mention them again. If you have symptoms, please stay at home and get a test, and share your contacts and self-isolate. That's the single most important thing you can do. For everybody else, if you don't have symptoms, try to reduce even more, if you can, the contacts you have with other people and the physical contacts. Wash your hands, cover your face, keep distance. We're going to continue, obviously, and keep revising how we support individuals and businesses. And like I said, outbreaks in settings are mostly contained quite quickly, actually. This is about household to household spread. And finally, when will it end? It's always the killer question. Well, things are getting better, and it probably is. I think from my perspective, I think we're probably at the moment almost at the worst point. So we've got very busy hospital. It's the middle of winter, but vaccination is here. Infection rates are dropping because of the lockdown, and we will get to some point where we have what people call herd immunity. However, we're not out of the woods yet, so lots of positive news, but please keep sticking with the programme. You've been absolutely fantastic. You're doing all the right things. Just please keep going a bit longer, and things will, I think, be looking quite different and better by the time we get to April, May, and so on. So I think, Jackie, that is all I wanted to say. So I'll stop sharing.
Thank you very much. Thank you very much, Susan. That was really, really interesting and very helpful, very informative. We've just before we go on to questions, we've had two panelists come into the meeting while you've been talking. So I'd just like to ask them to introduce themselves before we go on to the questions. Gulnaz, would you like to go first, please? No, if you'd like to introduce yourself, please, Gulnaz.
Hello, I'm Gulnaz Hussain. I'm from the Fairvale Community Hub, a grassroots organisation based in the heart of Fairvale. I'm also on the BAME Strategy Group for Public Health, and obviously I'm part of the Outbreak and Control Board. Thank you.
Thank you very much. Welcome. And Susan?
Hello, everybody. I'm Susan Bridgeford, and I'm representing the University of Sheffield. And my role there is the Director of Student Support Services.
Thank you very much, Susan. Has anybody on any of the panelists a question for Susan Hurd about the presentation? Douglas, thank you. Councillor Johnson.
Thank you. Yes, I just wondered, Susan, if you could give us any news on the latest position on vaccinations and the apparent rationing of them to Sheffield. It's very topical at the moment.
So yes, so we're in a good position in terms of vaccination and the percentage of vaccinations, people that we've managed to vaccinate in Sheffield and across Yorkshire, actually. And like you, I've seen the stuff mentioned in the news about what's going to happen with changing supply. Now, one of the things I do know about Sheffield is that the rate of supply of vaccine is our rate limiting step. So actually the NHS is doing an amazing job. Everybody's really geared up and vaccinations are happening all the time. And the thing that will slow it down is if we have less vaccine to put into arms. So we do know that's important. I don't know any more than what I've read in the media, to be honest, around what might or might not be happening about vaccination supply to Sheffield, and obviously vaccinations led by the NHS. It's an NHS programme, so I know. We haven't obviously got anybody from the NHS with us today, but I'm sure if Dr. Zach McMoney was here, who's the medical director for the CCG, the Clinical Commissioning Group in Sheffield, I'm sure he'd say that himself and local NHS Sheffield colleagues will be lobbying very hard to keep a supply of vaccine in Sheffield at the rate that we can stick it into people's arms. But that's all I can say, I think, because I actually don't know any more than that.
No, thank you. That's really helpful. I mean, I'm sure that our local NHS people will be doing everything they can to get as much vaccine into Sheffield, because they have already been getting as much of it as possible into people's arms, and it seems they've done a great job so far. No, thank you, Susan.
Exactly. Councillor Mohammed. Thank you.
More a comment rather than a question. And clearly, look, I think we've done really well so far. As a region, we've got about 64% of our over 80s vaccinated. If you look at Scotland, it's down to about 13%. So there's a huge disparity at the moment. But clearly there's a huge frustration. We've picked it up as an outbreak control board over the weekend. We had a bit of a discussion on it on Tuesday. We do have the capacity. Like I said, we could do, if we were all working at top speed, do about 30,000 a week. We could, like I say, in 10 weeks, vaccinate 300,000 people. That's more than half our population. So where we're really geared up to go, it's just a case of the vaccination. And I think what we've got to do is just keep being prepared here in Sheffield. And my message to people out there is, as and when you get your letter to kind of book an appointment, please do so, because it's still really important. There still will be vaccine there. There might not just be, I don't know, one surgery could do 800, but they might end up only doing 400 at the moment. But that doesn't mean they're not vaccinating. So that's the message from today, I would say to, I'm sure all my colleagues on the panel, they will say there will be vaccinations next week in Sheffield. It's not that it's run out. There might be not as many as we could do. That's probably to our credit.
Yes.
We've set ourselves up to be able to do it. So I think that's a clear message. I know the media will spin it the way they want to, but I think from our point of view, is that we have geared up with our local hubs. So there's a number of other ones being set up, and by all means, please take the vaccine must be the clear message. And let's see how we get on. Hopefully the government will give us the supply that we can ratchet up to 30,000. That's my ambition for my city. Thank you, Councillor.
Thank you. Thanks very much, Councillor Mohammed. I think it's really clear. I just have to say I'm going to have my jab tomorrow, because I got an invite, and I know I was talking to the person who phoned me up, who was from my GP, and I said to her, have you had one yet? And she said, no, I haven't. I'm sort of hesitating. I said, no, you've got to have it. The more people that have it, the better it is for everybody. So you might be frightened about having it, but you know what? It's the best thing. And I have to say, as Shafak said, I think it's been tremendous in Sheffield. The working together, the partnership working that we've seen across the city from the police, from fire services, from health services, from council services, from the community, from people in ordinary people in us across our city that have gone to GPs and helped with managing queues and all sorts of things. It's absolutely fantastic. And as Shafaka said, we've been told that in Sheffield we have the capacity. We just need the vaccines to give it out. And that's what we're asking from government. We're asking from government, you give us the vaccines, we can get it out. And we can get it out to everybody in our city, and then maybe go and help others nearby. You know, it's important that aren't doing as well, not doing as well because they're not working so hard, but because maybe they've got more people that are ill. So it's really that, and thanks very much for the presentation. I think it's very clear, isn't it? We are doing well, but as you said, as Greg always said, if he's here, we've still got a long way to go. So what's important is well done to us in Sheffield, but let's keep it up. It's difficult, I know. And I must admit, I did think when I got the invitation to go to her, I thought, now I can hug my grandchildren, you know, and then I thought, no, I can't yet. So there's that little bit of hope, but we can't relax it. Even us ones that have had the jabs, no good going to see your grandchildren yet, you know, not yet, not until we're told. Anyway, just want to say thank you very much. We've got some questions and we've had some other questions added in the chat as well. Not everybody's turned up who have put a question in, but what we're going to do is we will read out the questions that have been put in already by the internet. So we'll get those people, and also we will send a written response to all the questions that we have. So people will get individual written response, and they will be on the web, won't they, Dan, as well? So I think the first question that we had is a very, very poignant question, I think, and I don't know whether Joanne Baxter is here in the room to ask that question, Dan.
No, Joanne's not here, Jackie.
No,
I can read it out on her behalf if you would like me to.
I just want to say, I think Joanne's question is very, her obviously her parent or parents have died of COVID, which our heart goes out to Joanne and everybody across the city that has lost loved ones to COVID. And she obviously is in a council property, her mum or dad or whoever it was, her parents. And obviously in normal times, you have to move people out because you want more people moving in. We haven't got enough property in Sheffield for everybody to make sure, but we want to make sure that Joanne understands that we all feel for her, and we have to take this carefully, but then there are things we need to do on the public health level for the property as well. So I'd just like Dan, if you'd read out the question, and then we'll ask Magdalena if she would please answer it in the best way we can. Thank you.
Thanks, Jackie. So Joanne's question is, why are relatives still told to empty their parents' house and only given 2 weeks to do so when they have died of coronavirus?
So we wanted to say, Joanne, first of all, we're very sorry for your loss. As Jackie said, it's very poignant and very sad. The usual policy we've asked our colleagues in Sheffield City Council, council housing, is that people return keys within 2 weeks following a bereavement, but there is discretion, and the discretion is that families can hold keys for longer, and that they can apply an exception if there's difficulty paying rent after that 2 week rent-free period. Sheffield City Council, council housing recognise that things are a lot harder during lockdown. It's a bit more difficult to do everything. So they may show discretion more frequently, and I hope that's something you'll experience. They've asked our advice about decontamination. That sounds very medical and clinical and not very respectful, but just to be clear, we're thinking about your safety in clearing the property. So usually after 48 hours, any of the virus that's left on surfaces will start to decay and decline. And any kind of waste you take out the property, if it's bagged and stored for 72 hours, then that is usually good enough for the virus to decay. And just be very careful, because we know that the virus can last longer on hard surfaces like plastics and metals, door handles, glass windows, countertops, than it does on things like fabrics and curtains and carpets. So just be careful when you're cleaning, wear gloves, use a virucidal cleaning product if you can, like disinfectant, and wash your hands after you're cleaning, and hopefully that'll keep you safe when you're clearing the property.
Thank you very much, Magda. Thank you. We've got questions from the people who are also up in the gallery today. So what I propose is the next question is Christine Donson here. If she is here, can she come into
Christine also isn't here, so if you'd like me to, Jack, I'll read it out on her behalf again.
Thank you.
So Christine's question is, why did you vaccinate admin staff last weekend who can safely work from home before the over 70s and highly vulnerable group have received the vaccine? Also, what will you do about the ones who were offered the vaccine but chose not to have it if they have jobs visiting the elderly and vulnerable?
Okay, I'd like to bring in, there are 3 questions around vaccine. I'd like to bring in all questions first, if that's okay. The question from Kath Sorsby, and she is here, which is about PAs and people with disabilities. So could we bring Kath into the room, please?
Yep.
Sorry, Catherine.
That's fine.
Can you, we can't see you, Catherine, but are you okay to ask your question now?
Could Dan read it out, please?
Oh, of course, yeah, of course.
Okay, so the question is, there are hundreds of disabled people in Sheffield who receive a direct payment from Adult Health and Social Care so that they can employ their own carers or personal assistants instead of having unknown staff allocated to them each week by a care agency or care provider. Despite the government saying that staff in care homes and nursing homes will be on the priority list for COVID vaccinations because they work with elderly and disabled people on a daily basis, there's no mention of vaccinations being made available for staff such as my carers or personal assistants who support me in my own home. My staff and many others in the city who are employed by way of a direct payment provide personal care, and they support me with my physical, social and emotional needs on a daily basis, just as staff support their residents in care homes and nursing homes. My staff also work for other elderly, sick and disabled people, so they will be at risk of catching and or spreading COVID, as they will be in and out of a number of private residences each week. They are classed as key workers, just like the staff in care homes and nursing homes. So when will they be eligible for vaccinations?
Thank you very much, and thank you for bringing that question to us, Catherine. We've got somebody else who's also asked a question about vaccines in the gallery, Jane Thomas. Could we just ask Jane if she will come down, and then we'll ask her question, then we could perhaps answer all 3, if that's okay.
Hi, Jackie, can you hear me?
Yes, I can. I can't see you, Jane. So you just let me know when you're ready.
Thank you very much, first of all, for that presentation. I thought that was really good. And I am really reassured about what Sheffield and in fact what Yorkshire are doing. I think one of the things that is concerning us about the news report last night about the 50% potential drop in supply across Yorkshire and the North East. They said for next week, but also, you know, I understand other regions need to play catch up. But that news on the back of also some queries about the efficacy of the second jab if we delay too long, I think is really concerning. And therefore, I suppose this is a quite specific medical question, but how reassured are we? First of all, that A, we can leave that length of time between jab 1 and jab 2. And secondly, if there is a delay in supply to Yorkshire, are we compromising that delay? Thank you.
Thank you very much, Jane. So I'm going to ask Magda if she can answer Christine's first, and then was it Christine? Sorry. Yes, it was, wasn't it? No, Christine first, then Catherine, and then Jane. Oh, sorry, Dan.
Jackie, there is one more question on vaccinations if you want me to read that one out.
Oh, is there? Sorry, yes, please. Thank you. Sorry.
So I'll just read this out because it's from James Harrison, who I don't think is in attendance either. So I'll just read it out on his behalf. It's, why is it that certain doctors, such as far lane surgery, seem to have no information yet as to when the vaccinations are going to be carried out? Recent experiences and studies in Israel, China and Japan indicate that the first jab may only be 30% effective. Should the UK be reconsidering their decision to delay the second jab until 12 weeks?
Okay, that's lovely. So that's similar to Jane's as well. So the first one, sorry, it wasn't. It was Christine Johnson. Can you answer that, please? Thank you, Magda.
So this is a question about vaccinating admin staff. So the vaccination programme is led by the National Health Service. In Sheffield, that's the Sheffield NHS Clinical Commissioning Group and Sheffield Teaching Hospitals. And they have been given a list, all NHS organisations have been given a list by the Joint Committee for Vaccinations and Immunisations. And that's in the public domain. You'll have seen it on BBC websites. You can go to the JCVI paper yourself and you will see a list of priority groups. And health and social care staff who are frontline are priority number 2. And we have been told by the Prime Minister that the top 4 priority groups will be vaccinated by mid-February. Now, initially it was in order, so all the 80-year-olds first, and then by group 4 you get to the go down the age groups, so the 70-year-olds and the clinically extremely vulnerable. But now for operational effectiveness, it's all those 4 groups being vaccinated where they can. And this is about not wasting any doses. So the technical thing is that doses from the Pfizer vaccine, they have to be stored at -70 degrees. Now, not many people have got a freezer that is that cold. And they come in packs of 975 doses. Each vial has 10 doses in, but some people can get 12 doses out of a 10-dose vial, and some people cancel appointments. You might get to a situation where a surgery or a hospital gets to the end of the day, they've got 30 doses left, and they absolutely mustn't waste them. So they vaccinate people slightly out of schedule, or they vaccinate people who maybe aren't frontline. And that is because the cardinal sin, as my colleague described it, is wasting doses. So although non-frontline staff shouldn't be vaccinated, to avoid wasted doses, that may occasionally happen. And the other thing we've said is some people will see, they'll see on Facebook or they'll hear through their other contacts that somebody who's younger than them has been vaccinated before them. And that really is, everybody will be vaccinated by mid-February. Some practices in the north of the city may have more care homes and more over 80s. Some practices in the city centre have fewer older people, but they have more NHS staff. You will get vaccinated if you're in those top 4 groups. So please, I know it's very difficult, very frustrating. Please try and be patient. And please don't call your GP, because the time they're spent talking to you is time they're not spending vaccinating people or inviting them. So I know that's very difficult, but please be patient. Thank you for your patience so far. So
could I just ask, thank you very much for that. I just want to say something to Catherine, to Kath Sorsby, which is about her PA and the people who look after her, the people with the. And the only reason I want to say it is because I was at the Learning Disabilities Partnership Board on Tuesday this week, and this is an issue that came up there. And I know that Disability Sheffield and other organisations have been working hard to get to the bottom of this. And I also know that actually in the government guidelines that PAs are in the second phase of getting. They're along with care workers. They're included as care workers. But the difficulty that we've got at the moment, Kath, is that we as a city and the NHS don't have a list of PAs, because the PAs are often employed by individuals. So we're sending out via the council, we'll be sending out and getting in touch with other organisations like Disability Sheffield, to make sure we've got a list of PAs so that list can get to the people who need it. But just to reassure you, it's my understanding that it is clear they should be being asked to go for jabs now, get vaccinations now in this second phase, as the second phase is taken over. Is that right? I'm going to Magda. Am I right in my thinking?
Yeah, that's right. So just following on, other occupational groups are in phase 2, so they're not in this group. There was a question that Christine wanted to ask about vaccine refusal. So that would be down to occupational health, the employer, and any registering body for those staff as to what position they wanted to take on vaccine refusal. But of course, it's not mandatory to have the vaccine. The more people who can be vaccinated, the more it protects us. So the greater coverage we have, the greater protection, and that's even more so. So the lower the efficacy, the more vaccination coverage you need. So we would strongly encourage, if you're invited to have a vaccination, to have it. The social care staff, as Councillor Jackie Drayton has said, the Sheffield Director of Adult Social Care and our Human Resources Director are working hard to identify frontline staff in social care, and that's whether they're employed by the council, whether they're our commission providers, which includes the voluntary community and faith sector, or whether they're paid by direct payments. And they're collating lists, and the details will be passed to NHS colleagues.
Before you go on, sorry Magda, I couldn't see it, Catherine, I'm sorry. You've raised your hand to ask a question, so just to come back, and it's on her question, so I'm just, Kath, can you hear me?
Yes, fine.
Yeah, could you ask your question or supplementary?
Yes, I think when you spoke just before, Magda, you hit the nail on the head precisely. Yeah. I've read all the government guidelines. I know what should be happening, but there's always the word should. And personal assistance, it was known in March last year that Sheffield hadn't got a list of who they were or where they worked for. Now I'm partially reassured by Magda's comment, that people are working on this, but I just want a name, I want a contact so that I can give somebody my PA's names and addresses, national health number, whatever. We are desperate to get them known and on a set list. We're not receiving any information at all other than from Disability Sheffield, who are mostly volunteers, who are working their socks off. But we need to know, please, what's happening.
Thank you, Catherine. I think, as I said, I've had an email from officers who have told me the letters will be going out to people, but the difficulty is that we haven't got a list of all those people that have got PAs and as well. So we are using organisations, like you said, like Disability Sheffield, but we will be sending letters out beginning of next week to make sure, or text or emails to get that information, and that is on the top of our list. So hope that answers your question.
Thank you very much.
Okay, thank you. Thanks for coming as well, Catherine. Jane Thomas's question. Sorry, thank you.
So we had, this is the question about first doses, I believe, and about the Israel study. So first doses, the first dose of Pfizer is believed to be 89% efficacy, and the first dose of AstraZeneca is believed to be 74% efficacy. And for any COVID vaccine to be approved, it has to be over 50%. And to put that into context, the flu vaccine that people get every year is 40 to 60% efficacy. So these vaccines are very efficacious on the first dose. The clinical guideline is known as the Green Book, not called the Green Book, but everybody knows it by the Green Book. And that says that second doses should be given between 4 and 12 weeks after first doses. So 12 weeks is okay. And if the interval is longer, you don't need to restart the vaccine. So you don't end up having 3 doses. You are just given your second dose as normal. It doesn't need to be restarted. So just to put that into context, that people have looked at people's natural immunity from having had the virus, and people think that's between 3 and 6 months when that starts to wane. So the best science is that the first dose should have high enough efficacy, and that the 12-week interval is okay. What's happening in Israel is, I can understand why it's concerned people. And there are 3 things that I've read about the Israel study. One is that the very important thing is it takes time to build immunity after your first dose. So 2 weeks, 12 days, you do need to be cautious after your first dose, because you don't have, the minute the needle leaves your arm, you haven't got 74%, it's not 74% efficacious the minute the needle leaves your arm. It takes a while for your immune system to build up. And some people have got weaker immune systems, and it might take them a little bit longer. So people who are HIV positive, for example, they might need to wait a little bit longer because their immune system might not be as good at building up that immunity. So that might not have happened in Israel. People might not have waited those 2 weeks. The second thing is, it may not stop people getting the virus. It might make their symptoms very, very mild. So it's very, very good at stopping hospitalisation, severe disease and death, the vaccine, but it may not stop you getting the virus. And that's why we say you may still be able to transmit the virus when you've had the vaccine. I know that's a little bit hard. It's a bit of a hard message, but it's the vaccine's very, very good at reducing severe hospitalisation, severe disease, hospitalisation and death, and they have seen that in Israel. The third thing they say is what happens in a clinical trial and what happens in real life are different. So what we're seeing in Israel is real life. And it's very, very important to watch any countries that have done their vaccination programme before us, learn from them. But it might be too soon to tell. It might be too soon to tell from real life what's happening. I've got the other question.
Could I just, sorry, one of the questions that was added that Jane asked, and also I think James as well, which was, who isn't here, was what happens if we haven't got enough vaccines to the people who've had the first vaccine of the Pfizer vaccine and the other one. I think everybody feels that the Oxford one, there'll be more, but the Pfizer one, everybody's had their first. If they've had the first Pfizer and they weren't in the range of having the second one, but we're now gone to 12 weeks, it's changed from 3 weeks. What happens if we run out of Pfizer vaccine? Because we know you can't combine the two, can you? You can't have a first Pfizer and a second Oxford. So what happens, and do we know there will be enough for the second vaccinations?
So the clinical guidelines say that you should receive the second dose of the same vaccine you had for the first dose. So that should be on your notes, and hopefully people will remember as well. But in extreme circumstances, it's better to have a second dose of a different vaccine than not have a second dose at all. So that would be the exception rather than the rule, we hope. But having a second dose that's different is better than not having a second dose. And that again, if you want to look at that yourself, if you type in Green Book COVID into your search engine,
Such bollocks.
you'll get a sorry, I can hear a critique of this answer. Sorry, if you type in Green Book COVID in your search engine, you will get something that says 14A, chapter 14A of the Green Book, and that is the clinical guidance. It's based on science.
But I think, I'm sorry, I'm sorry to interrupt, but I think, Magda, what people are thinking about, we're saying now we won't have enough vaccines to give them out to people in the first round. We're hearing that in the paper, you know, we're hearing that. And what the point is, I think, which you can't answer, and maybe none of us here can answer, but the point is, one of my questions is, should we be holding back, or should we be, for the Pfizer vaccine, should we be giving a second dose to the people who had the first dose and give all the first doses of the Oxford, because we know that we can get more of the Oxford, if we are aware that the amount of the Pfizer means the people that have had it the first dose won't get the second dose. But Susan had a hand up.
Okay, Jack, I wasn't sure if you could see me or not, because I know you can't.
No, I can. Thank you.
So I think we've got to be really careful here, and this is, vaccination is an NHS-led programme, and I'm conscious that I don't work for the NHS, and Dr. Zach McMurray isn't here, and if he was, he would be able to give a better answer than I'm going to, but I am going to make an attempt to answer that question. So I think, first of all, we need to be clear that we're talking about stuff we've read in the newspapers about a reduction in potential vaccines. So we don't actually know what's true, and we don't know what's going to happen. And Zach, if he was here, he might know a bit more because he'll be in on those conversations. So we've just got to hold that in our minds. We don't actually know whether there's going to be any decrease in supply next week or any other week. Secondly, because it's an NHS-led programme, the NHS will make decisions about how the vaccine, who gets it, when, and all the rest of it, as they are doing just now. And what Magda said is absolutely true. All these decisions have been made. And I would say that these decisions have been made by the Joint Committee for Vaccination and Immunisation, which is a UK-wide committee, which has existed for years and years and years. And it makes decisions about all our vaccinations and immunisation schedules, so all the children's immunisations and so on. So a bunch of experts who are really knowledgeable. And Professor Chris Whitty, the Chief Medical Officer, and Jonathan Van Tam, his deputy, who I have immense amount of trust in and respect for, are making these decisions as well. So there are trade-offs in the decisions around, do you follow the precise schedule for vaccination that was done in the trial, or do you actually expand the weeks, because then you can get more doses into more arms for the first jab? And Professor Chris Whitty is confident, has conversations with Director of Public Health every week about this, that yes, these are trade-offs, but this is the right trade-off we want to make to maximise or to reduce the number of people who are dying from COVID. So I just wanted to add that as a bit of a context, and I'm conscious that I can't speak for the NHS, but I think there's a bunch of stuff we're talking about that we don't know. And then the NHS locally will make really sensible decisions based on what they're being told centrally around how do we need to adapt if we are going to get a bit of a reduction in vaccine. How do we adapt it so that we can carry on vaccinating the most number of people and get the right doses, the second jab at the right time, and so on.
Thanks for that. And I think it's clear, isn't it? We do have every confidence in the NHS, in the scientists. And I just think it's fantastic. And I have to say, Jane, and to others out there, I know very well that the councillors sitting around this room, this table, we're not at a table, but the councillors here from the parties that they represent will be in touch with their MPs and their colleagues in making sure they are pressing this sort of question to the government. So I know completely it'll be talked about in a different way. I'm not speaking for Councillor Johnson and Councillor Mohammed, but I know that we will all be having the question, we all listen to what you tell us, what the people of Sheffield tell us, and whatever party we come from, we unite together going forward and saying, this is what we need. We need answers to these questions. These are the questions that have been put to us by the people of Sheffield. So that will be happening somewhere else. That's not to say we don't value and recognise the work the NHS is doing and all that scientific information. We need just to press the government to make sure we have confidence that they are getting the vaccinations for us, which is the NHS can't do what they do unless we get the vaccine. So that's the thing for me. Sorry, I don't know whether, I think I saw a hand over here. Yes, Councillor Shafak Mohammed.
Yeah, just in response to what you've just said, Jackie, I mean, obviously this issue around the vaccine, the potential shortage, you know, like I said earlier, we picked up at the beginning of the week. I already have informed Ed Davey, who was our leader in the House of Commons, but more importantly for me, also Paul Scriven, who's a Sheffield resident, member of the House of Lords, who kind of helps with health matters. So it's been raised. Paul is well aware of it because of his own kind of background. Initially started working in the NHS, and what we need to do is kind of get the message out that we are concerned around the supply. But it's like I said earlier, there will still be vaccinations in Sheffield next week. But we will continue to lobby behind the scenes, Jackie, like we all are doing. Okay.
Like I was just going to say, done exactly the same. We've done exactly the same as well, and I'm sure Douglas has. That's what I was alluding to. And we'll all come together to put a strong voice, you know, from Sheffield. There was whether you got. Sorry, I interrupted you, Magda. But the other thing was, I think it was just James who isn't here. That it was a little bit that you wanted to add to him.
So, Mr. James Harrison did ask about GP practices if that GP practice isn't offering the vaccine. The way it's being done is that if your GP practice isn't offering the vaccine, you'll be in a catchment area and with a number of GP practices. And if your GP practice isn't offering the vaccine, another GP practice in your catchment area will be, and you will be invited to that practice. So don't worry just because your GP practice isn't, and just thank you very much for your patience, and they will get round to everybody.
Yes, I think, isn't there 15 centres across the city that GP practices have clustered together, and so you won't necessarily go to your own GP to get it. You'll be going to somewhere else. That's right, isn't it? Yeah. Okay, lovely. Fantastic. So sorry about that. We took a long time on that, but I think we answered several questions. Just going back. David, is it David? Is he here? Dan?
No, I don't think David is here. I can put his question to you if that would be helpful. So David's question were, why are libraries in Sheffield still open for IT and digital access plus click and collect? Before the lockdown, Sheffield libraries were only open for click and collect. The Saturday before lockdown, Sheffield libraries announced they would be opening for further services. What logic are Sheffield City Council following here? Are they aware that Unison have called for the full closure of libraries across the UK to contain the pandemic?
Thank you very much. Magda, do you want to take that one?
So thank you, Mr. Kirkham, for your question. Libraries are allowed to stay open in Tier 4 areas for certain purposes. And this does include digital access to public services. And this is because many public services are now online, including benefits applications, mostly online. So there is a balance of risk. So there are the possible potential risks to staff and public of going to a COVID secure venue versus the risks of digital exclusion and harm from people not being able to do things like apply for benefits or other things that they need to do, they need to access online. So that's where that decision has come from. We always refer to that there's a SAGE paper with tables that looks at all the different risks, and it looks at things like the risks of community centres staying open or closing, and things like socioeconomic disadvantage and health inequalities are really key in those decisions. So those decisions are about protecting the most vulnerable in our society and making sure they're not excluded. So although we obviously respect Unison, they do have to protect their members, and staff are their members. Obviously, there needs to be a bit of a wider view, and that does include respecting the public and Sheffield citizens and their need to access services.
What's happened there? Sorry.
That's my phone because people are still ringing. So
No,
sorry.
no, that's all right. Thank you. Thanks. Sorry. Thank you. Just everybody moved screen and it gets really disconcerting. Thanks for that. Thanks, Magda. Just wanted to say thank you. And just want to say we've had a question from the gallery, and it's a question that Simon, Superintendent Verrill, can answer because it's for him, because it's about policing. And if it's okay with Paul, who's in the, I know he's in the chamber, in the gallery as well. I'd like to take Philip's question first because Simon might be gone. But what if we take your question next? So apologies, Mr. May. We'll go with Philip Long first. If Philip can be brought down to the room, please, Dan. Lovely.
Thank you. It was just a very quick question to ask Simon Verrill to tell us about any challenges for policing at the moment. Thank you.
Thank you very much, Philip.
Yeah, thanks very much for that, Philip. I mean, obviously, there's it's a new environment for all public sector agencies, and just like everyone else, it does present challenges and opportunities really in equal measure to some degree. I suppose the first challenge for policing, a bit like everyone else, is the challenge to our own staff, realistically. So we have some reasonably significant abstractions all the time because our staff are either have COVID or are isolating on the basis of government guidance. So we're running at something around a 10% abstraction of staff at any one time, and that really just has to get covered by other police officers working just that bit harder, quite frankly. So that's one of the things for us. The next one really is, I suppose, what I would describe as the enforcement balance, because it's quite a difficult job for us at the moment. Firstly, to keep up with the government guidance and legislation. It's no fault of theirs, but it does change fairly regularly. And just keeping our workforce understanding that and making the right decisions. Police officers always act with discretion across the board, realistically. And sometimes we'll get that absolutely spot on, sometimes we won't. But I suppose at the moment, we get sort of praised and challenged in equal measure. So that probably is an indication that across the board, we are getting it about right, because some people are saying we're doing too much enforcement and some people are saying we're not doing not enough. So I suppose that would mean somewhere in the middle is probably about right. So those are two obvious ones. I suppose less obviously, we have seen reductions in crime, and particularly with lockdown at the moment, there is no nighttime economy policing requirement, so it does provide us with some opportunities there. I think our biggest concern around crime realistically is crimes against the vulnerable. And it is a worrying, it's worrying us across the national context really. I think there's an expectation that things like domestic abuse and crimes related to people's mental health are on the increase. But actually, I suppose more worrying from the police perspective is this isn't actually getting to us in terms of the increases in reported crime. So I think intuitively we would all expect that there are some people who are vulnerable and cannot do anything about that in lockdown, but that isn't necessarily getting reported to the police, which certainly is something that causes me a good degree of personal concern that there's people out there that aren't getting to us. But I mean, broadly speaking, those are the main issues I think for us at the moment.
Thank you very much, Simon. I think thanks for the question, Philip. I think one of the other things that came up at the Prevention and Management Board earlier in the week was this worry and concern that a lot of the carers were having in the carer centre about this, I'm going to call it scamming, people ringing up and offering vaccinations to people. And what I found was very, very helpful following that meeting we had Simon sent some information over that the police have got out. You know, we've got our trading services sending, we've got in the council services sending issues out. And just to be very clear, you should not have anybody contacting you asking for any bank details, asking you for any money, or asking you for anything like that, and telling you that they're ringing on behalf of somebody who wants to give you an injection, because you will only get rung by your GP or a GP or a letter from the NHS. And I know Simon and the police are doing a lot about that, and I know so is the council and the council services. But message out there, if everybody can get it, especially to older, more vulnerable people, please do not give anybody your bank details. That is the vaccine is free. Sorry, Simon, do you want to add anything on there? But I think it's really important, isn't it? You're doing a tremendous job in all areas, and it's important because we are trying to do consensus and education policing. So we don't, but we will go to enforcement if people aren't doing what they should be doing. That's right, isn't it, Simon?
Yeah, that's absolutely correct. I mean, obviously at the moment, we're doing more and more enforcement because it's quite clear that most people should by now understand the rules. So I think the expectation is we enforce more and more. Around the scams and people, it is a cause for concern for us. What I would say at the moment is, whilst we will message out, and those messages, Jackie, are absolutely right, you know, there is no charge for vaccine. We need to make sure that the more vulnerable understand that and get that message out. However, what I would say is that at the moment there is no information or reported matters that are coming to us specifically in South Yorkshire or Sheffield. So it's not something we're seeing at the moment, thank goodness. But we need to be very alive to it, because criminals will make the most of any opportunity they possibly can. So absolutely, I'd agree that those are important messages to get out.
Thank you very much, Simon, and thank you very much for the question, Philip. Really appreciated. We've just got to go to Paul May's question. Is he Paul there? Paul here? Thank you, Paul, and thanks for being so patient and waiting. Really appreciate it. Would you like to ask your question, please?
Yes, thanks. Now, Peter May was a cricketer of my time. Maybe does he go back to your time? Anyway, it's Paul May. It's all right.
No sorry.
No, don't worry. This is a question on test and trace, which is a major issue your board, of course, is working on all the time. We hear that the Sheffield test and trace system is an improvement on the national system, but that the two systems are working seamlessly together. Is this right? Is it seamless? And secondly, what would you say are the hurdles and the obstacles for you and the Sheffield test and trace system? I mean, how successful is it? Have you got some success criteria? Thank you.
Thank you, Paul. Magda, is that you? Yeah.
Yeah. So the NHS test and trace team, they pass details of people that they haven't been able to contact to the Sheffield teams. So there will be a threshold of the number of attempts and number of days that they try to contact people before they pass it to the Sheffield team. The Sheffield team pick up those referrals from the national team, and their success is that they make contact with 75% of those that the national team can't reach. So that is very effective, and we're very pleased with that. And both teams work well together. There aren't many hurdles, but one hurdle is about the timeliness and completeness of information. And that's both from us as members of the general public, when somebody from contact tracing asks us who we've been in contact with. If we give, surnames and contact details of people that we've been in contact with, they can much more rapidly follow up our contacts. And then also, if that information is conveyed from the national team to the local team, that helps. But contact tracers are very skilled, and contact tracers, even with kind of first names and mobile phone numbers, do an extremely good job. So yes, it is effective.
Thank you very much, Magda. Thank you. Is that okay, Paul, or do you want to follow up?
Yeah, I think so. I'll have a little think about that and maybe come back another time. But another quick point. I do look at the past notes for previous COVID board meetings. I'm not sure if they're all there. The last one I saw was September sometime. Are they updated? Anyway, I'll ask that question.
Okay, thank you very much, Paul. We'll follow that up if that's okay, and we'll make sure they are on if we haven't had any, because we definitely have been meeting. I think the panelists would all agree with me. We have been meeting. Okay.
Because
thank you very much for the question, but you need to know we've been meeting as well and what we've been saying, don't you? I appreciate that.
Well,
too.
exactly, and I do find, yeah. Okay.
Okay. So okay. Thank you.
Sorry, Paul. We've been definitely meeting fortnightly, and often it's been weekly sometimes.
Yes, exactly. Thank you. Thanks ever such a lot, though. Really appreciate it. Now, there was something in from Adrian. Sorry, not Alan. I'm getting all the names wrong. I'm so sorry, everybody. Adrian. Where is he? He's gone. I can't find him. Is he still here, Adrian? Is Adrian still here? Adrian Lane?
I can bring him in if you would like me to, Jackie.
Yeah. Would you like to come in and ask your question, Adrian? Questions? Hello, can you hear us? We can't hear you. You're a bit... Yeah.
Hello, sorry,
better.
I'll put a headset on. Is that better?
That's better, yes, lovely.
Yeah,
Thank
hi,
you.
sorry, I've been chatting a little bit on the chat there. I've actually got quite a long question. Perhaps I could drop it into you via email instead of
that would be really helpful. That would be really helpful, and then we can put it on our chat as well. We can not on a chat. We can put it on the questions and answer page, and so everybody sees it. Adrian, that would be really helpful.
Okay, if I could ask Susan or Magda just to comment briefly, and the question revolves around this. It's about the this whole PCR question in terms of the Corman-Drosten review, and I'm sure they know a lot about this, and in terms of the cycle thresholds.
Sorry to interrupt, but you know, when you say PCR, Susan and Magda might know about it, but people who are listening or watching this later might be saying, what's PCR? Like me. What is PCR? Sorry,
the PCR is the test, the kind of considered gold standard for the current COVID testing, and it has been proposed from January last year and then accepted by the World Health Organization as the gold standard for testing. It's a very clever thing invented by a chap called Kary Mullis in the 70s, and it amplifies genetic material to see whether or not that genetic material represents the virus you're looking for. That's the kind of summary which Susan and Magda might concur.
That's fantastic. Thank you very much, Adrian. I've learned something today. Thank you.
There's been some massive criticism about the cycle thresholds, which is effectively the sensitivity of the test at which we run the test here and in the rest of the world, and also the standards of certification and the standards of the tests throughout the laboratories in the United Kingdom and also the world. And my question, which I will send to you, relates on, given that everything we're doing and saying relates to a PCR positive test up until more recently, because now we've got lateral flow, we've got antigen, we've got various other methods of looking for this virus, because this test does not find a virus. This test amplifies a bit of genetic material and comes back with a kind of a bit of a binary, yes, we found a bit of genetic material, no, we didn't. But we're taking that yes as a case. We're taking that yes as an infection, having run the tests at extremely sensitive rates. So my question is, given that there's this critique about the test now, and the World Health Organization published 2 days ago that we actually may want to look at the sensitivity of how we're running the test, and that we should also not run the test on its own, we should use clinical diagnostics. In other words, is there somebody ill, not did they get a positive test? Should we not be questioning as a local authority? You guys are the experts. I mean, I've just read up on this. I'm not an expert. Should we not be questioning that? Because everything we've done thus far has been based upon this binary yes, no. We found a tiny bit of genetic material, and everything, positive cases, infections, case rates, and so forth. I'm not denying the NHS is having a struggle, and I'm not denying people are dying and had, you know, March, April, we had a massive, you know, a massive problem. I'm just questioning the rationale, and you know, I don't want to be seen as kind of one of these deniers or dissenters. I'm on the same side as everyone else. It just feels that everything that we've got, all the numbers that are presented by the government, all the numbers that are presented by the Office for National Statistics, the 28 days following a positive test, all these things rest on this one binary yes or no to we have been able to find a tiny fragment of RNA in this patient's swab. And that's all I'm questioning. So I will put this, yeah, so Susan, I'll be delighted to hear you speak, please. Thank you.
And thank you, Adrian. We will, if you've written that question in, you will get an answer, and we will get an answer to it. I realise now you meant the PCR tests. Sorry, yes, I know what that is. Sorry, everybody. It's been a long day. Susan.
Thanks, Jackie, and thanks, Adrian. And yeah, we'll get a full answer back to you. And I think that would be helpful because it's quite a long, complicated answer. And I think everybody's getting quite expert in some of this terminology now. So PCR stands for polymerase chain reaction. That's what it actually stands for. And you're right, you're absolutely right in how you described it. So I guess what I'd say just off the cuff, and we'll get you a proper answer, is so none of these tests are perfect. There is no test that is perfect, and it usually is a combination of a bunch of stuff. So the tests are pretty good. The PCR test is actually pretty good, but not 100% perfect. And that alongside diagnostic clinical symptoms, signs and symptoms is important. So there is definitely somebody who has symptoms of COVID and tests positive for COVID really probably does have COVID. And there is a difference between a little bit of a difference between how accurate the lateral flow devices are, the new ones that give you a result without having to go to a lab, versus the PCR test, which has to go to a lab and you get the results back. So yeah, so there is, I think there is no such thing as a perfect test. But what we're trying to do, obviously, here in public health terms, is find people who've got disease quickly and take them out of the chain of transmission and prevent it spreading and so on. And that works. So these tests work in that context where we've got to work really quickly to find people with signs and symptoms. And in I suppose in population terms, you want to get the bulk of people who have got infection isolated. It does mean that on occasion we'll isolating people who actually didn't have the disease. And that's one of the negative effects, I suppose you like, for individuals, but at population level, it's of less importance than making sure we do something to get people out of the chain of transmission, and vice versa. So we'll get a full answer back to you, but I suppose I want people to know that, or to have confidence in these tests actually, because yes, they're imperfect, but I think it's important that we stick to some of the really basic stuff we know, which is if you have symptoms, it is really important that you get a test and you self-isolate. And as the lateral flow devices start to become more frequently used, there's other messages that we need people to understand about some of those tests. And the main message for those is, if you test negative, you still have to act as if you might have COVID, because they're a bit less sensitive about picking up people who do actually have the disease. But send the question in and we'll get as full an answer back to you as we can.
Thank you very much, Susan. Thank you. And I think you make an important point. And thank you, Adrian. I think what we're saying is here, what's really important is that if you have the symptoms, go and get the test. And if the test is positive, please self-isolate, and that's really important. I've got one more question from Christopher and Jenny Pennell about university students. I don't know are they in the room? Are they in the, and can you see them? Are they in the?
Yes, I'm
down?
here.
Oh, you're here. Oh, you're here. Lovely.
Yes, I am
Christopher.
here. Well, I'm only half here. Jenny isn't here.
Okay, lovely. Christopher, thank you. Thank you very much. Would you like to ask your question, please? And thanks for putting it in.
Yeah, well, I'm really conscious that Sheffield is known as a city of steel, but now it's known as a city of students, actually. It has two very successful universities. It was very obvious to those of us who live in Sheffield in the autumn that when the students came back, it produced a big spike in coronavirus in Sheffield, because they're coming from all over the country. And that's a weakness the system has whenever there's a lot of people flowing into an area, and that happens with students. What assurances have we got looking forward that that will not be repeated? You know, opportunity for Susan Bridgford here, but also the cost of the students on the other side and the controls on them is actually a rather poorer university education than I got over 50 years ago. So how are you managing to make sure they have decent contact and a valuable education despite the controls that we, the population, still need on them?
Thank you very much for your question, Christopher. Just before I bring Susan in, and I'll also ask Susan or Magda if they want to say a little bit, I just want to say how in Sheffield we do have a history of working in partnership, and how wonderful it was, you know, last year when we had that issue that the universities, our public health team and other councillors and other council officers came together and tried to do something to help and help students as well as helping the city in that time. And it was really, really a valiant effort, and a valiant effort by both universities and colleges to make sure their students were safe. So I'll ask Susan if she'd like to come in first, and then I'll go to you, Susan Bridgford, and then Susan Hurd. Sorry, thank you. Susan from University of Sheffield.
Thanks, and it's a really good question. I'm sure lots of people are wondering about that as well. So thanks for the opportunity to offer a bit of an explanation. I think the short answer is that we've learned, and the government have learned from what happened at the start of the autumn as well. So every university in the country has received detailed guidance from government over the last few months about how to handle student travel, both in December when students were going back to their home addresses, and now as we're looking forward to students coming back. So this is being mitigated in lots of ways. So currently we have a very restricted number of students who have returned to Sheffield or who remained in Sheffield over Christmas. And the government has prescribed particular courses where the students are permitted to come back and to continue their studies. So that's a small number of courses, largely in health disciplines, so medicine, dentistry, and other health subjects, and also social work education and teacher education. So that's the small group of courses where we are offering face-to-face teaching currently. For all other programs, teaching is online and must be online until we are through to the end of national lockdown. For Sheffield University, that means we have less than 20% of our normal student population in the city right now. So it's a much smaller number. We don't know what's going to happen with national lockdown, although we might expect that that period will be extended, and it's likely there, if that were to happen, that online learning would be extended as well. When we do get to a position, and we hope we will, where we're able to resume some face-to-face teaching, then the return of students will be staggered. As it was in December, there was a travel window of a week, and we sought information from students about what their travel plans were, and we liaised with local travel companies as well to try and manage those flows of people. So we will do the same as and when we are permitted to resume face-to-face teaching for those other programs where the students are not here currently. For those students that are back, and as and when they do come back, we've also got a testing regime set up. So students are advised that if they are coming back to Sheffield, they must sign in at our test centre, which is a test centre offering lateral flow type testing. and they must sign up for 2 tests 3 days apart. And this is to try and deal with the situation of the sensitivity of these tests. So if you take 2 tests, you're more likely to get a reliable result. If you get a positive test, then you follow that up with a PCR test to get confirmation, and you must self-isolate as well. And the universities have got support in place for students who are self-isolating. If they don't register for a test, when they return to the city, then they must self-isolate for 10 days, as is the norm for other types of travel, people entering the country and so on. We have worked really closely with local public health. So where we have face-to-face teaching taking place, and that is being done in a safe way with all the protocols that you'd expect around social distancing, ventilation, wearing of masks, and so on. So we're confident that on campus, we have not seen evidence of transmission taking place through face-to-face teaching on campus, and all those controls remain in place. The other side of your question was about essentially value for money and quality of education for students in this year. And everybody would accept that this is not the usual experience for students this year and not what they would have expected when they were choosing their universities. That said, the whole sector has worked really hard to transfer learning online and to make sure that that learning and the assessments that go with it are high quality. And that has been a colossal effort. We've also backed it up by providing IT kit to students. Not every student is in the situation of having an ideal situation with perhaps a laptop and broadband connection and so on. So universities have sought to meet those gaps where they exist and have provided the kit that's necessary for students wherever they are to be able to get online. We've also worked really hard at the quality of online teaching, and since March last year, when this happened quite quickly, we've learned a lot, and we've greatly increased what we're able to offer and the ways in which we're offering that. And we would also, as a sector, want to convey the message that online teaching isn't necessarily, in fact, it definitely isn't cheaper teaching. So we still have to employ the same academic staff. We still have the same buildings open on campus. We have study spaces available on campus at the moment. But staff are working really hard on online learning, and we believe it is a high quality offer in terms of enabling students to still achieve the learning outcomes that they need to gather that knowledge, acquire the skills and knowledge that they need, and hopefully graduate successfully at the end of this process. So I hope that's given you some answers. I'm very happy to take any further questions around that as well.
Thank you, that's very comprehensive. Thank you.
Thank you. Have you got anything you want to add, Susan Hurd?
Yeah, just very briefly, a little bit of the epidemiological context. I think this is really important that we had a spike in September, not just because of the students. So the students were a significant component of that, but it wasn't all students. It was a lot of other 18 to 30-year-olds as well, particularly and predominantly driving that. So I think that's really important. The student body increased the spike perhaps a little bit higher, but then actually dropped quite quickly from student infections because both universities did such a brilliant job of managing large outbreaks. And yes, they had support from folks in my team and lots of other people, but actually the 2 universities handled that extremely well and did a brilliant job. So within a couple of weeks, there was a very large spike that was related particularly to students had dropped, and we were still at a really high level of infections. So I think that's just a really important contextual point so that folks understand that, you know, we have more of an issue in the city than the students coming.
Thank you, Susan Hurd, and thank you very much, Susan Bridgford, for a very, very comprehensive answer, and it's wonderful. Thanks for the work you've been doing too. I think, thank you very much, Christopher, as well. Finally, we've got one question left that was sent in the person isn't here, but Danny, can you read it out, please? And then we'll answer that very quickly if possible, and then okay.
Yeah, so this is from Helen Kirkham. Her question is, I run a successful travel business from home as a franchisee. During the pandemic, I have not had any income from my business due to the decimation of the travel industry, and my only income currently is £530 universal credit per month. I am ineligible for the self-employment income support scheme as I operate as a limited company, and so the discretionary regional grants would be a financial lifeline for me. Could you please explain, therefore, why Sheffield City Council are excluding business owners who work from home and who are also franchisees? Other councils in the UK, i.e. York and North East Derbyshire, are not imposing these exclusions on applicants, so why can I not get financial help for my business in Sheffield? Surely these grants are exactly for businesses such as mine.
Thank you very much, Dan. I think we'd all be, you know, so it must be devastating for Helen rather, to see her business, you know, go through what you know, this time, and it is really difficult. But Magda, I know that the grants that we're giving out, I thought the grants we're giving out as a council were legislated by government and the government rules. Do you want to just, have you got any information, Magda, that will help us explain this you know, sort of anomaly? Thank you.
Yeah. So firstly, Helen, as Councillor Jackie Drayton said, I'm sorry for the difficulties you and other business owners have been facing during this pandemic, and thank you very much for all you're doing and for your patience with the different lockdowns and all the change. The grants are made available by the government, and they come with quite strict criteria and guidance. So, for example, they have to be spent on people with fixed property costs, and rate-paying businesses in particular being prioritised, and they're not supposed to provide income support. So the local authority has been working within those guidelines. However, Sheffield City Council are going to launch a discretionary scheme, and they're going to allow businesses and the supply chains of businesses, quite importantly, to apply for grants based on loss of activity and ongoing costs, and home-based businesses will be able to apply. So that will be launched shortly, and the Business Sheffield website I'm sure you look at anyway, but that's always a good source of information for local businesses.
Thank you very much. Thank you, Magda. I think, is that right, Dan, that is the last of all the questions we were sent in, and I haven't seen anything else on the Q&A on from anybody else in the gallery. Is that right? Is nobody sitting there thinking, why haven't we asked answered my question? That's lovely, fantastic. Well, thank you all very much, all the people that made contributions. I think the answers were really, really clear, and hopefully explained a lot to people, both in this room and up in the gallery, but also out there watching. I don't know whether anybody's got any other business that they want to raise at this point. No, yes, no. If not, I'd like to say thank you very much to everybody. Oh, a minute, Catherine Salisbury's raised a hand. Oh, is that something else that's from another time, is it? Sorry. Okay, I think
I can bring Catherine in if you would like me to.
Has she raised her hand?
She has just raised her hand now. So
Okay, lovely. Yes, please. Thank you. Thank you, Catherine.
I just wanted to say thank you very much. I've connected to a lot of these Zoom meetings recently over this kind of issues, and this has honestly been the best chaired and the most informative meeting I've been in on the last 6 months or more. So really appreciate that. Thank you very much to all of you. Very professional.
Thank you
really
very
well
much.
done.
Thank you very much, Catherine. And we will get something to you about, making sure you get your information back about your PA and your other helpers. Okay.
Thank you very much.
And I didn't pay you to say that, did I?
No, not at all.
Okay. Thank you all very much. Thank you. Lovely to hear from you.
We've also got a hand up from Christopher from earlier as well, so I'll just bring them in as well.
Right.
My mistake. Sorry, it was my mistake. I hit the wrong button. Now, having said that, it's been a very good session, so I'll just add my thanks. Thank you very much indeed.
Oh, thank you very much, Christopher. Thank you very much. Thank you. Sorry, Councillor Shafat Mohammed.
Yeah, just a suggestion, Jackie. We've had some fantastic questions today.
We have indeed.
The answers have been very detailed. Would it be possible to just put those questions on to the website as well, Dan? Yes. So at least we know that, even if we don't have to necessarily have the people's names if that's an issue with GDPR, but I think the topics, in particular were quite good, actually, quite broad, business, PAs, etc. And obviously vaccines were a big issue. I think the answers were quite good and detailed, and those that couldn't make it today could be interested in not sitting through an hour and a half trying to find a question, what point this question is going to be asked, but it could be there. So it's just a suggestion there.
I agree. I think it'd be really good. You know, we have a frequently asked questions page, I think, don't we? You know, to get some of these on there would be really helpful, I think. And the answers were excellent. Thank you to everybody that gave answers. It was really good. And I know it's not just you who are here today, but you've got information from your teams behind the scenes as well. So it's much appreciated. Can we do that, Dan? And also, I think, you know, I think it's, I don't know what happens. I know this is on, this recording is on for a certain amount of time, but you can go on and watch it, can't you? So, I mean, I think there's something about putting a link to it and saying, look, this is, because numbers have gone down, and I think it's really important. I think the questions came here today were excellent, weren't they? And we got lots of information. I certainly learned something. So it would be good to get more people coming and asking the questions that are worrying them in our city. Let's see what we can do about that as well. But thank you all very much. I'm going to close the meeting now, else I'll be known as a terrible chair. Okay, thank you all very much. Have a lovely weekend and stay safe. Take care and stay safe. Bye-bye now. Thank you.